Good morning, everyone. I'm going to give a couple of minutes to make sure we have everybody logged in that's logging in, and then we'll get started. Okay, good morning, everyone. Thank you for joining us today. I'll go through what we have for the agenda and then a couple of updates that I have for you. So we'll go over the dashboards and talk about the data with Steve. Dr. Velasquez will provide an update. Lindia is available to provide an update for the general response. We will check in with GSI, with Alicia. And then if anyone has any items they'd like us to specifically go over, I can add those. I know we will talk about the vaccine this morning, but does anyone have anything else? Okay, if you do, you can put that in the chat, or when we get to that open discussion area or time in the meeting, bring that up. So last week at our meeting, we did the presentation on vaccines, and just want to thank you all for your input and support on that. Dr. Velasquez and Lindia have been meeting with different groups and have some of those meetings scheduled for this week, just to get more information out on the vaccine and the plan. And one of the things that we've had to be really clear about with the vaccine is that it's constantly changing, right? The playbook and how it rolls out. And yesterday, I'm sure most of you saw the announcement from the governor that there are going to be 7 vaccination sites that he and his team are going to be providing the vaccine for, and pulling together the teams to work at. And just to kind of prep all of you, we have very little information about that here at the Health District. So if you have questions, we can try to answer those, but we have very little information on them. So just want to kind of manage everyone's expectations related to that. So as we know more, we'll continue to get that out to everyone. So Steve, I see you're there, and we will have you start going over the data.
All right, good morning, everybody. For the week of January 10th through the 16th, we had 2,018 new cases reported. That is fewer than 2,295 the prior week. Our daily average was at 288, where it was 327 the week before. The breakdown of those cases, there were 1,930 that were confirmed, 68 probable, and 20 still unassigned. For the 2-week totals, between January 3rd and the 16th, we had 4,313 cases, a little bit more than 4,109 the prior 2 weeks. a little bit more than 4,214 the prior 2 weeks. For age groups, it's just about the same as always. 20-29 is the highest at 20%, with 30 to 39 and 40 to 49 at 15% each. For our rate per 100,000, for the past 2 weeks, we were at 837. It was 818 the prior 2 weeks. The non-adjusted rate, so just confirmed cases, is at 797. We had 41 new hospitalizations, Spokane County residents that we knew were hospitalized in that time period. There were 85 the prior week, so that's a big decrease. Currently, there are 103 people hospitalized in Spokane County. Unfortunately, we did have 9 new deaths reported last week, an individual in their 60s, 5 individuals in their 70s, and 3 in their 80s. That's a very big decrease from 37 new deaths the prior week. Our testing numbers have gone up. I've also kind of changed the dates a little bit to make sure that we're matching what the phase assessment has. Our average number of individuals tested is 1,102 during the week of December 31st through January 6th. Total tests in that period were 7,711. It is an increase from about 882 average tests a day. And then our average test positivity has gone up to about 25.8%, which is a increase from 21.2%. For healthcare system readiness, currently we have 991 staff beds, 1,501 licensed beds available. Our occupied census for staff beds is at 89%. For licensed beds, it's about 59%. And our total COVID census for staff beds is 10.4% or 6.9% for licensed beds. There are currently 8 surge or overflow beds in use. And then really because of the holiday, there's not a whole lot additional I can update on except for the unemployment insurance claims have gone down slightly. There were 1,880 between January 3rd and 9th. There were 2,144 the prior week. The industries impacted most were food services and drinking places, specialty trade contractors, and administrative support services. And that concludes my report.
All right, any questions for Steve? As a follow-up to last week's call, I believe that Mayor Woodward had a question about the dates on the roadmap to recovery. And I did verify with DOH that the reason those 2-week periods are different at the top of that report that show the phases or the 2-week periods is because they are using the 2-week periods that they felt that most confident in the data from. So that's why there is a discrepancy. So I don't see Mayor Woodward on here, but okay, looks like Sarah can report that. Thank you.
Amelia, I'm sorry, I'm on the phone.
Sorry.
That's okay. I think I'm an unidentified caller on the meeting. My laptop wasn't working very well. Thanks. I appreciate that information. I know that there's been some discrepancy in even the data that DOH has admitted that they are not being able to get or that they're providing. So that's a little concerning to me, I think. I do have one quick question for Steve, if he's still on the line. I had a constituent. Okay, thank you. I had a constituent reach out and ask about how many laboratories that we have currently being used to run our PCR tests. Is that something you would have an answer for?
It's something I can get an answer for. Lindia or Dr. Velasquez might have a better idea than I would, but certainly something I can look up.
Okay, that would be great. Thank you so much.
All right, any other questions? Okay, I'm not seeing any other questions. So Dr. Velasquez, you want to hop in with your update?
So good morning, everybody. And Mayor, we do have a list that tracks all of the laboratories, so I can share that with you.
Thank you so much.
Yeah, not a problem. It's one of the areas that we keep track of exactly who's doing what kind of tests. So good morning, everybody. And I'm looking out my window and I cannot tell whether the windows are dirty or there's a little bit of snow. So That's disconcerting. But I hope everybody had a good weekend. As you know, it was an interesting weekend, and more to talk about that. But I had 3 brief updates as we're pivoting to some new projects. I want to touch on 2 things. One that is has moved forward, one that is moving forward, and that one that we're starting. So the one that has moved forward is our effort with education. We are on the monitor and control phase as of last week. And what that basically means is we are receiving, analyzing the data provided by the various school districts, schools, and other educational entities, and we'll provide the feedback necessary. We'll address a process for 30 days and come back and either realign or improve as needed. So we're already on the moving forward basis on that one. And I just wanted to close the loop on education with all of you. And I do appreciate the partnership with our superintendents, principals, and all the school officials. Some of the areas that we have improved, like the office hours, are being incredibly productive in terms of answering hands-on issues on how to or what to, which is where we wanted to get with the line of sight to higher grades going forward in the future. So that's one update. The second has to do with our testing task force. And last week, I'm happy to be able to report that all of our work groups gave an update as they are meant to every other week. And some of them are moving faster than others. That was anticipated given the complexity of some of the groups, but they're all making significant progress. And I wanted to highlight 2 specifically. One is our testing and technology work group has also been tasked with making sure that the current testing modalities we have available in the region are able to detect the variants that are of interest. And I know that everybody's heard about the variants. There's right now 3 of them that are of interest. And the reason why I say that is because the virus has had other mutations before, but that are not significant in terms of its behavior. But to the best of our knowledge, the current testing modalities that are available in the area are still have the ability to detect the variants, and that is because they use multiple antigens as opposed to just one. So even if there's a mutation on one of them, you can still follow the others. But we're going to keep track of that because we do expect that the virus will continue to mutate over time. That's what viruses tend to do. And although this one has been a little bit slower than others, such as the flu, is something that we're going to track, and that work group is tasked with following that for the foreseeable future. One of the conversations that has come up regarding testing mutated, no pun intended there, into a conversation that is parallel. There was some testing hesitancy in some segments of the population. I think we've overcome that for the most part. And there is now a parallel hesitancy with vaccines and immunization with some segments of the population, some of it because of history, some of it because of age groups. And the reason why I bring that up is because it's an area that we're working on already. The district is working on that through the equity task force as well as the testing task force. I just wanted to highlight that. But it was interesting that it came up within the context of hesitancy with testing, hesitancy with vaccines. And I can tell you is an area that is very, very important. And I'll just mention one example from my own personal experience. So I had a conversation with my 87-year-old uncle who lives in Iowa about his concerns about the vaccine. In terms of, am I going to get the disease? What else is in the vaccine that I don't know about? Which is not an uncommon question for some. And we've had a few of those conversations. On the other hand, I had a conversation with my 87-year-old father-in-law who's in a nursing home in New York, and he got the shot the same day I did because he was confident that it will work. And the reason why I bring that up is if you've been tracking, Israel has immunized about 25% of its population, more than perhaps any other country. And I mean, the population is a little smaller, but it's still significant. And the most significant finding they have thus far is drop of about over 30% of infection rate in people over 60. So despite the fact that it's a low number of 25% and 33% is not a incredibly large number, but 30% is pretty good change on the good direction. So that does tell us that herd immunity will work, which is the theory behind all of that. And I focus on that group because we all know that that's the highest risk for morbidity, mortality, and complications of the virus. So it's a little bit of a sidebar, but I think it's an important conversation that we all need to be aware of. And I think we all need to try to participate as much as we can. So I want to move on to an area that we are starting to work on. Well, let me rephrase that. We've been working on it, but we've been working on it on a case by case. And what we would like to do is apply some of the same discipline of a process to the area of events, venues, et cetera, not because we're anticipating any events right now or in the short term, but because we want to make sure that we're having the conversations and we're ready when that what is to happen. So we're pivoting to that, and I'll have more on that next week as we get organized. But I just wanted to give you an idea of kind of like the breadth of work that is happening at the district with the various teams here. So with that, I'm going to stop and see if anybody has any questions for me. Commissioner, good morning.
Good morning. So, Frank, one of the questions I had is on testing. As we saw that some of the regions, are at a 7% rate, we're at a 17%, 18% rate. And I know that, for us, we're testing people that we think are, have symptoms or have been in contact with somebody. I mean, insurance doesn't pay if you're not, if you don't have a reason to have a test. And so just wondering if you've been checking in with some of the other health officers in those regions to see kind of how they're getting to those numbers versus where we're at, because we've never, I've kind of watched this all along, and we've never been down below 10%. And so just seeing if you have kind of some thoughts on that.
Thank you, and that's a great question. And yes, there's a conversation that we health officers have had. We've had the same conversation with the Department of Health. And the reason for that is, as you pointed out, the way we're utilizing testing is for cause, meaning you're either symptomatic, you were exposed, or there is the probability that you were exposed. So by definition, as a general rule, when you do that, the positivity rate should be higher. It should be higher because you're using the test appropriately. As indicated, and mainly, and the reason why I say as indicated is because the testing they're using for this number is the PCR test, which is the diagnostic test, the viral test. They're not using the antigen testing, which is used for surveillance. So we've had this conversation a couple of times because it makes it a little bit complicated for not just for us, but for many of the other, particularly many of the other large areas where the population density is higher. Those percentages, if we use PCR, they're going to continue being higher. So we've been advocating for the other types of testing to also be considered, such as antigen testing, because as we increase the number of tests we do, particular antigen testing, when we start doing it more for surveillance, it should invert, meaning the majority of the tests should be negative if we're using it appropriately. So we're on those conversations. We don't have an outcome yet because the metrics came out in the last 2 weeks or so, but it's something that we put on the table already because we do worry about that. If you look at today, as of last Friday, the other three metrics were where they need to be, and that one was still, as you pointed out, was 17. I think today is 25, so it changes every other day. The second issue is we've also asked the state, which they're working on. They had a concern about the number of negative results and including the negative results because of the volume of those. So we're making sure that all tests are being counted including all of the negative tests. And we put in a request, and we'll continue reinforcing as we do more testing, which we should be doing more testing, but not just for diagnostic, but also for surveillance. We will need to include antigen testing. Otherwise, the percentages are going to be somewhat skewed over time. So I'm glad you brought that up, because it's a very active conversation, because most of us have exactly the same concern for the same reasons, and it's reasonable. I think the metrics, the way I look at this, all of these things are work in progress. At least from my perspective, the team, the governor's team, had some specific metrics to look at, and as we work with them, we'll provide feedback and we'll realign as time goes based on what the improvements necessary are. Good question. Thank you.
Thank you, Frank.
Other questions for Dr. Velasquez? All right, Lindy, if you want to hop in.
Okay, good morning, everyone. And I would just add to the testing question that the state is also thinking about moving more towards a sentinel testing method, which whether that turns out for us or not, I'm not sure, because it just kind of depends, again, if they're counting PCRs and antigen or just the PCRs. So we'll see how kind of that turns out too. So I just wanted to give a little update on behavioral health impacts before I launch into the vaccine update. As you know, the state does like every other week report, and the latest report that I have is the end of December. They have 5 of 5 indicators: psychological distress, suicidal ideation, suspected suicide attempts, suspected overdose by all drugs and alcohol. And all of the 5 exceeded the 2019 levels for the 4th reporting period in a row. So end of December was a low point, I feel. A statistical warning was observed for alcohol-related emergency department visits among adults ages 18 to 44. And the updated data regarding product sales of beer, wine, and cannabis tax revenue did show a year-over-year increase throughout 2020 compared to 2019, as did the FBI background checks for handgun purchases. So those are all measures of a behavioral health concern. Frequency of depression symptoms appears to decrease as household income increases, which is something that we probably all intuitively know. And those who identified as African American and 2 or more races reported the highest rate of symptoms for both anxiety and depression. So definitely some disparities. Domestic violence continued to increase in the number of offenses being reported. So we'll see as maybe some hope comes around with the vaccine and things, and maybe as the 2021 has kind of a light at the end of the tunnel, potentially these measures will improve. At least I hope so. Vaccine. So as you heard from the governor yesterday, they have moved counties who have finished phase 1, tiers A1 and 2 into tier B if they have the vaccine and are able. They've also moved down from 70 plus to the 65 plus population. And then with the multi-generational households, those 50 and older with elders in their household would be eligible. And then moving to congregate settings. So we'll have to adjust again all of our materials and phase charts and all of that to coincide with what they're doing. The state has partnered with Microsoft, and they will be unveiling a new vaccination statistics dashboard. It will show the number of first and second doses, which means you can see how many people have started the 2-dose series and how many have completed the series. It will also show the percentage of the population that's fully vaccinated so far. So doses administered by date and more. So the confusing statistic that I keep hearing is that there's a percentage of doses that we receive in the state that have been distributed in the state to the different providers, and then the percentage that is actually administered. And so the latest statistic on actually administered throughout the state is around 42%. Although they know it's a little bit higher than that because just reporting is not being completely done throughout. So the goal of the governor is to increase the capacity in the state. So as we get more and more vaccine, we'll have the ability to administer them or actually get them into the arms of people. So as Amelia mentioned, there will be some mass vaccination clinics that will augment those venues that locally are being done already or will be done. And then there will be a criteria of if the vaccine providers haven't administered the vaccine, 95% of the vaccine within 1 week, their vaccine will get reallocated to somebody else who can get it out there. So there will be some movement of vaccine, and hopefully that will really hold everybody accountable to get it in the arms of people as fast as possible. Last week, we did talk a little bit about long-term care facilities, and the federal pharmacy program has made a lot of progress on the timeline of working with CVS and Walgreens. They started their first round of skilled nursing vaccinations December 28th, and it ended last Sunday. Their second round started January 4th and will end January 24th. And then in combination with the pharmacies getting vaccine out, we are also sending out our own staff as vaccinators to facilities that did not enroll in the federal program. So if you didn't enroll, you have not been a part of that pharmacy administration. So the smaller ones, we have been working with different entities and getting people vaccinated. So we are working on that. And as we hear about long-term care, skilled nursing facilities, adult health, and that they have not been vaccinated, we focus on them to make sure that they can get it. I think that's it. So if there are any questions around the vaccine.
Hey, Lindia, this is Dan Barth. I know last week we had talked about the long-term care facilities. Appreciate hearing that. Is there any data regarding how many in Spokane have been involved with the CVS and Walgreens process relevant to each one that you track?
I believe the state has that information, and it's something that I've struggled to try to get a hold of. I can reach out to one of our staff again just to see if we can get a better picture of who is enrolled in that and who is in this final stage. Even just the number of long-term care SNFs and all of that has been kind of a moving target. So data is not always good.
Thanks, though.
Lindia, this is Mayor Woodward. Thanks for that. I know the health department doesn't have a lot of information on the vaccination site for the arena. Has the Department of Health given you any indication of when that might be up and running? Or do you have any idea when you might get more information? Because I know the media is very hungry for information, and my office gets contacted constantly about that.
Yeah. So the only thing that we heard yesterday was on the call and that they were potentially going to start this next week. So that's a pretty fast implementation of a mass vaccination clinic, but it is possible. Chaz is out there right now, so we have a call to Chaz just to figure out, you know, if they're not going to be at the arena, where are they going to be going with their clinic? So yesterday was like the first we heard about the whole plans from the state.
Okay,
Yeah.
thank you.
Yeah, Mayor, I think that brings up a really good point and something I kind of wanted to just, clarify. I think it would be helpful as community leaders to help reinforce that, we're getting the information out as soon as we have it related to the vaccine and to everything with COVID. I literally got a phone call Sunday afternoon that the governor was going to be making an announcement, and they just wanted me to have a heads up because one of the places was going to be in Spokane, and the person who called me didn't have any details beyond that. So I think, a lot of the community is getting frustrated with like not having information. And I think we are somewhat too, it's like things are happening and we're trying to get it out to all of you and to the community partners fast enough. So, yeah, I mean, we had that conversation because we knew as soon as it was announced yesterday afternoon, we knew local media would have a lot of questions. So our team came together really quickly to try to put, what we knew out there. But again, we have such limited knowledge as well. It's hard to stay up on all those responses because we don't know with some of it. So, yeah, we're trying to just to reiterate, we're trying to get everything out there as much as we can and as fast as we can.
No, Amelia, I completely understand the challenge, and as community leaders, we want to help you be able to articulate the same message and information. It is frustrating when we're not getting it directly from the state. I heard about the news conference yesterday on social media. Very, very rarely do I ever get a heads up from our Eastern Washington representatives in the governor's office, which is it's frustrating because people do want to know. The community and the media are both hungry for information. And when you have a news conference out like that, the first thing I get is a call wanting to, just with more information about how this is going to be carried out. And anyway, so thank you. Thanks for all you guys are doing. And I know you're really great at sharing the information. And we just want to help you with that.
Yeah, absolutely. Thank you. We appreciate that. Any other?
I was just going to say, we do have a vaccine collaborative that has started now with our healthcare providers, and they are probably meeting 3 times a week right now, trying to figure out the different ways to get the vaccine out. So even as this mass vaccination gets rolled out, we're going to continue working with our local venues and continue to get it out in a variety of ways. So even if the vaccine doesn't come fully for this huge effort that they're doing, we still will be getting vaccine for the other ways to get it out, like the multi-care, Kaiser, Providence, pharmacies, and those places too.
Just a quick question. I know this morning I had heard from our local Kiwanis club about people used the app, and then at the end when they qualified for this round, they got like a scheduled date or something like that. They're telling me, like one of them said they got a confirmation that they can get the vaccine on February 1st or something of that nature. Have you heard anything about that? But then they come to me and ask me where do I go to get it, right? Because now they get a date in their hand or some sort of card or certificate saying they're eligible. Anything that we can pass on to those kinds of?
Yeah, so what I understand is that they would be texted or emailed where the actual location is when their date comes up. So it's right now, it's just telling them when they're eligible, and then later they would be notified of where to go.
Other questions for Linda before GS? Oh, looks like Dan, do you have a question?
Yeah, I was curious, just having talked to, within the system of how much of the vaccine is actually available, is there any sense of confidence in the volume that is allocated for Spokane County in order to logistically really make this happen?
Not over the next 2 weeks, but what we understand is that the federal government is going to increase supply from the manufacturers in about 2 weeks. You probably heard on the news that the reserve was depleted for the second doses, and so that was not available. So now they're just sending it straight from the manufacturer to us. There's basically no guarantees there, so.
Other questions? All right, Alicia and Kara, GSI.
Good morning, everybody. Very few updates. I think the two things I would say is glad that Dr. Velasquez will be able to join our board meeting on Monday to talk vaccinations and any other pieces. I think that's from an employer perspective, that's the number one question, much to the conversation today. And some of our employers are part of the efforts in King County as well. So a lot of interest in how the employer community can help support vaccinations here in the region. So that is keeping us busy, and so glad Dr. Velasquez can join us on Monday. And then just legislative session, and I'd say the two things I just note in case you haven't seen them is that Governor made some changes right before the session on hospitality capacity. So we're seeing some movement for some of the restaurants who have the ability that have garage doors and some of those kinds of things for increased capacity. But early to see how that all looks. And then there is a bill up this week that looks at restaurant capacity specific legislatively. And so we have a number of folks from the Spokane region that are restaurant owners that are set up to testify at that. So just if there are things that are coming up, let Kara and I know on that front. We have our state lobbyists tracking a lot of those pieces as we look at supporting reopening and jobs. So a lot on transportation this week as well, which is important for getting people back to work. So I think those are the two main things. I don't think Kara had anything else this morning, but always happy to answer questions if folks have them.
Go ahead, Doug.
Hey, Alicia. Eventually we're going to get this, whatever eviction freeze is going to end. Is that something that you guys are working on your end, looking for funding sources or being able to offer people grants for rent protection or anything like that? I think everybody knows that's going to be huge once the moratorium finally ends.
Great question. We're tracking a lot of the pieces. We're not the front lead on the eviction moratorium pieces. A lot of the municipalities and some of the other kind of housing partners are, but I feel like between transportation and housing, those are the two issues that we're hearing about every single day because they're critically important from a support of people and recovery standpoint. So we're tracking all of it, but we're not the active lead on it.
Other questions for businesses? Okay. Commissioner Cuny, I can usually tell when someone's camera comes up. That's usually I know they want to weigh in. Go ahead.
Well, I just thought since, Alicia was talking about some of the legislature and stuff that, just bring up that there's the public health bill. I think it's a House Bill 1152 that is 11:52, because there's another one we're talking 11:55. So I think 11:52 that would analyze public health. And so, just know, I think everyone needs to take a look at that and see what their thoughts are. At Spokane County, I know we'll be opposing that. I know WASAC, our county association, is very active in trying to talk through that. Part of it is it's a conversation that, yeah, we can have and we should have. But it's also, now is not the time during this pandemic to be having us, it potentially being thrust upon all of us, that it's like, it's something that needs to be a really thoughtful process to see what's the issues that, that is driving this. And partly we're seeing that, the whole rollout of the vaccines has been a regional process from the state. So, we're kind of getting our first inkling of what a regional process would look like, and how that information isn't really getting down to the local jurisdictions. And so, anyway, just something for everyone to be aware of, to take a look at that, and if you're willing to weigh in on that. I think what Thursday is one of the first hearings on it. So, just having you be aware.
Thank you, Commissioner. Any other things before, next up is open discussion, if anyone has anything to add in there or any additional questions. All right. Kelly, was there anything from communications that we needed to touch on?
No, I mean, just that everything is, we tried to be very prepared as what we could anticipate the governor would be announcing. So we attempted to address at least the 1B group on the website, and we will be talking about vaccinations coming up on Facebook. So we'll be able to get a grip on what questions are out there and try to answer those to the best of our ability by Wednesday morning. And we'll just continue to get the information out as quickly as we can, and respond to what's happening with the state as soon as we get information. I have a communicators call today with healthcare PIOs, so I'll be able to talk with them and see if they're hearing information today as well, that we can make sure that we're all consistent and collaborative when it comes to our messaging.
Thank you, Kelly. All right. Well, if we don't have any more questions or thoughts, I think we're good to adjourn. We'll check in next Tuesday at the same time. And if you have questions, I know Lindy and Dr. Velasquez are going to be out in the community virtually doing some of the vaccine updates this week. So you may see them at your organizations or other meetings. So with that, I will see you all next week. Thank you.
Guess it's just us now.
Yes, I didn't know I was being so studious.
No, this is you. Just, and everyone else is like,
I'm trying to be emotionless.
yeah, it's hard. They're all stretched so thin, and so